New at 7, there is a bit of a double whammy health concern in the triad. As the school year starts within the month, North Carolina's Cyclospora cases are growing week by week, with researchers still working to link a common cause.
Why this pilot
At the same time, North Carolina is one of 41 states under CDC monitoring for growing COVID cases. Joining me live this morning is Dr. Cynthia Snider, infectious diseases physician with Cone Health. Thanks for being here.
Oh, thank you very much for having me here.
So the CDC, as I mentioned, is monitoring North Carolina. We're seeing a slight increase in the number of cases they're noticing in Guilford County, Rockingham County in particular. But that's a little bit in conflict with our state dashboard, even though the dashboard is not regularly updated like it used to be, but it showed a slight decrease in COVID hospitalization. So what are you seeing at Cone?
So we are definitely seeing just a little bit of an uptick of respiratory viruses, people coming into urgent care or the emergency room to be evaluated. And so it's not unusual to start seeing some COVID cases this time of year.
So say you do suspect you have it and you want to go get a test for it and it's positive. What are even the quarantine and masking guidelines these days?
So we are still fortunate that, you can go to the grocery store and get the COVID test. And for the most part, those are still pretty accurate. And what we recommend for quarantining is, just stay at home, try to take supportive care. For instance, if you have a fever, you can take Tylenol, ibuprofen. And generally, we'd like you to stay at least masked for 5 days.
Okay.
And when it's safe to actually get to work, a lot of workplaces want you to not have any fever for at least 24 hours and your symptoms improved. And so I think that lines up with that 5-day.
Fever-free without the use of a fever suppressant, right?
Exactly.
Okay. All right, so that's good information to have, especially heading into the fall. You are still recommending the vaccine and say there's a new formulation coming out soon.
That's right. So we suspect that the new vaccine formulation will come out sometime in September. And this will incorporate just the latest strains. And I think that's a good thing to have for anybody who's over 65 or anybody that has risk factors for severe disease.
Let's talk about Cyclospora. We got a new update last week. This dashboard updated every Tuesday. It shows about 718 cases since May, several hospitalizations for Cyclospora. And you say that's likely an undercount because people are not simply getting tested.
Right. I think we know that Cyclospora has a little bit of a delay as opposed to other causes of like food poisoning. And so, it's like 7-10 days later. And some folks have it mild initially and then becomes the more typical of extreme.
Shooting diarrhea.
Yeah, explosive diarrhea. And so some doctors may just initially just give antibiotics rather than test, but I think there's some importance to testing.
I know the state health department has not linked a specific cause, but has said it's looking at cilantro and parsley. Does that mean we should feel safe eating lettuce?
That's a good question. So what we know that, nationwide, there has been a link to iceberg lettuce from a huge manufacturing company that also feeds into a lot of our grocery stores, a lot of our restaurants, as well as fast food chains. And so I think everybody's making those changes appropriately. I think like proper food handling is so important, like washing your lettuce. If you take a whole lettuce rather than prepackaged, getting rid of those exterior leaves at first. But I think it's starting to get better. Still probably would avoid some iceberg lettuce.
Okay, avoid iceberg, wash all produce for the foreseeable future.
That's right.
Dr. Snider, thank you so much for your time and your expertise.
Oh, thank you so much.
You can find a link to the COVID and Cyclospora dashboards on the State Health Department's website.